Bismillahirrahmanirrahim. Assalamu alaikum. A 27-year-old newly gravid woman come to the office with her husband due to inability to conceive. The patient and her husband stopped using barrier contraception a year ago and have intercourse every other day. The patient has a period every 28 days that lasts 5 days with 2 days of heavy flow. She had brief pelvic pain approximately 14 days after her period start, but intercourse is not painful. In her late teens, the patient was hospitalized for a pelvic infection. During that time, she had pain with intercourse, discharge, and fever. She has no other medical or surgical history. Her sister had polycystic ovarian syndrome. The patient husband age is 31 and has no children, and his semen analysis is normal. The patient blood pressure is 128 by 76 and pulse is 82 per minute. Physical examination show no abnormalities. Which of the following is the best next step in management of this patient? Hysterosalpingogram, laparoscopy, mid-cycle LH level, serum FSH level, serum testosterone level. This patient is 27-year-old newly gravid woman, and she came to the office due to inability to conceive after having time sexual intercourse over the past year. And her last teen, she is admitted in hospital for pelvic inflammatory disease. The patient husband semen analysis is normal. So based on these hints, which is the diagnosis of this question? The diagnosis of this question is primary infertility. So this primary infertility. The diagnosis of this question is primary infertility, and the management for the primary infertility in this case is hysterosalpingogram to look for the fallopian tube. Hysterosalpingogram. So here the correct option is choice A, hysterosalpingogram. Why the choice A is the correct one? Because this patient history of hospitalization during adolescence is likely due to pelvic inflammatory disease, an important cause of infertility due to tubal scarring and obstruction. This patient has primary infertility, which is failure to conceive after a year of unprotected time sexual intercourse. The first line imaging test to assess fallopian tube potency is a hysterosalpingogram, which involve infusion of radio contrast into the cervix under fluoroscopy. Come to the incorrect one, laparoscopy. So a laparoscopy is useful for direct visualization and treatment of peritoneal adhesion and endometriosis. Choice C, mid-cycle LH level. So this patient has normal ovulation, so in such cases no need to do mid-cycle LH level. D, serum FSH level. So normally the ovarian reserve typically begin to decline at age 35, and serum FSH level are increased in women with are increased in women who have a declining capacity to ovulate. Choice E, or serum testosterone level. So this patient has regular cycle and no hyperandrogenism symptom, for example hirsutism, irregular menses, so no need to do serum testosterone level. So here the correct option is choice E, A, hysterosalpingogram, because the most common causes of primary infertility due to pelvic inflammatory disease, which causes the fallopian tube to scar and obstruct. So that's why this patient having primary infertility, and we will the management of this patient in such cases is hysterosalpingogram to look for the potency of the fallopian tube. Thank you.